Yeah, go ahead. Everyone from the media, you folks ready? Good morning. Thank you for attending this announcement. My name is Nicholas Oliver. I'm a lifelong Rhode Islander, born and raised here. Go Townies. For the past decade, it has been a privilege to serve as the Executive Director of the Rhode Island Partnership for Home Care and its Political Action Committee. In this capacity, I also serve on the Governor's Commission on Aging as an appointee of then Governor Raimondo and reappointed by Governor McKee. Lieutenant Governor's Long-Term Care Coordinating Council as an appointee of Speaker Circacci, and chair of the state's Home and Community Care Services Advisory Council as an appointee of former Democrat State Rep Maria Cimini, now the Governor's Director of Healthy Aging. Since 1990, the Rhode Island Partnership for Home Care represents home care providers across our beautiful state. With a workforce of over 8,000 nurses, physical therapists, occupational therapists, speech and language pathologists, social workers, nurse assistants, homemakers, and operations staff. Together, we provide care to over 21,000 Rhode Islanders in almost 21,000 different locations. We travel over 1 million miles across the Ocean State each year to deliver the highest quality home-based healthcare services, such as personal care and homemaking, visiting nurses, pediatric nursing, infusion services, palliative care, and hospice and end-of-life services, all in the homes of Rhode Island's most vulnerable population. It is the most intimate setting of healthcare that requires a great deal of personality, privacy, and respect. For our long-term patients, we become part of the patient's family because of the close bond that is created in providing activities of daily support and skilled nursing care at home. With that said, we are businesses, most of whom are small, independent proprietors, such as the one that we're in today, just trying to do their best to serve their community and be the employers that their staff, like those behind me, will want to choose to stay throughout their career. Annually, we generate over $650 million into the state's economy. Only 15 to 17% on average per year is through the state's Medicaid program, a disastrous and mismanaged system that has over 600 people waiting for home care in any given month. There are no solutions to fix the system and too much complacency by the current administration to care. The solution is simple. We need more money to bring more people into the workforce, to serve more people, to reduce the long wait lists. Many of Rhode Island's big problems have only become so great because there's not the leadership to solve them. The current administration touts a Rhode Island 2030 plan, a draft that has been sitting on the shelf collecting dust for over a year now. It offers no real solutions and does not mention the home care crisis once. It does not mention how the administration will resolve access to care barriers for home care or hospice, not even once. Taglines like, "We cannot leave anyone behind, regardless of their zip code," are meaningless without substantive action. Or, "We're especially here for our Black and brown communities." They're also meaningless without substantive action. We have neighborhoods where we used to have police presence so we can serve difficult communities. That is no more. We have schools that are now failing where we used to have new home care workers. We used to have sustainable funding to pay staff above minimum wage and be competitive in the local labor market. That is no more. Dan McKee likes to prop up Willa, his elderly, frail mother, in his ads. There is no doubt that Willa will receive quality care for the remainder of her life. But will yours? Will you? You and your family have paid into the system through payroll taxes for decades. When your moment of need arrives, the governor has done nothing to ensure that you or your loved one will get timely access to home care. Just ask those that are currently sitting on the wait list. The governor and lieutenant governor do not care if you are the next one sitting at home or lying in your bed without help to get up, without help to go to the bathroom, or without help to get food or water. That is a day in a life on someone on Dan McKee and Sabina Matos' wait lists. And they are doing nothing to help these people. Many of them are women and minorities. Where are their health care rights? Will you or your loved one be next? A vote for those currently in power is your vote that says that treating our sick and our disabled as castaways and second-class citizens is okay with you. That is not okay with me, and it is not okay for any of us. Am I right?
Right.
We have a Health and Human Services infrastructure liken itself to the Trump administration. No one has a sustainable role in McKee's cabinet. An acting Secretary of Health and Human Services. We're on our second acting Health Department Director. An acting Human Services Department Director. And do I even need to mention the failures of DCYF and how many acting DCYF acting directors we're on? I've lost count. All of whom are operating departments in significant disarray at the peril of our most vulnerable citizens and subject to multiple oversight hearings and investigations. It is likely that none of these folks will even be here in a few months. We cannot take care of people when everyone in our HHS leadership already has their feet out the door. We raise issues with our current governor and lieutenant governor and offer cost-saving solutions to resolve the problems with the sustainable workforce and timely access to home care and hospice. They're at the State House in comfortable offices on Smith Hill. We're on the ground serving people in the community. You would think they would listen to us. Under this administration, we have experienced a vaccine mandate that we did not ask for, that led to over 700 home care workers leaving the workforce last November and never returning to Rhode Island's home care industry. We need higher reimbursement rates to take care of Rhode Islanders in outlying communities and unsafe neighborhoods. Instead, we received temporary funding that came too late and will end before any substantive funding will replace these grants, leaving workers the choice to go back to minimum wages or quit. Our employees do not perform minimum wage work. The response that we've received from the governor is that we'll deal with this issue after the election. McKee's inaction has led to employee burnout covering the work of multiple people and rising Medicaid costs to the state for more costly hospital emergency department visits and skilled nursing home stays. Getting money and resources in the hands of home care workers should be the priority, instead of being an outlier in the country by hurting employers through state taxes, such as Federal Payroll Protection Program, PPP forgiven loans, and federal employee retention tax credits. Separately, the Lieutenant Governor has only met with us once, last November, promised to come back to us with solutions, but disappeared, never to return. The community is tired of playing Where's Waldo with Sabina Matos. She needs to show up or get out of the race. We need those that want to govern and lead, not duck and cover. To add insult to injury, we look to our Lieutenant Governor to be an advocate for home care. In that role, the occupant serves as chair of the Long-Term Care Coordinating Council, Emergency Management Advisory Council, Small Business Advisory Council, and most recently, the governor, then Lieutenant Governor, took on the role of Alzheimer's Research and Treatment Coordination, something in which he, nor his successor, have any statutory authority, expertise, or capacity to meaningfully convene. Largely absent from these roles, the current Lieutenant Governor is not reliably there. When Sabina is, she often blows in and blows out, just like Dan did in his 6 years as lieutenant governor. There is no leadership, no coordination, no solutions, and definitely no results. Distracted and uninformed, I even had to get Sabina's attention at a meeting just 2 days ago by shouting across the room, "Hey, Lieutenant Governor, this is important for you to learn. You should be paying attention." No constituent should ever have to implore their elected officials to pay attention to issues impacting so many Rhode Islanders on a daily basis. Neither Dan nor Sabina are effective in helping those that keep our local economy going. We need leaders with substantive business background. Leaders that have been kept up at night, working to ensure that their company will earn enough revenue to cover payroll at the end of the week. Sabina does not have any business skills or background of any kind and cannot relate to most of those in which serve on her advisory committees. Dan's only business background is being related to his brother, the McKee who actually kept his family's multi-generational oil company running. And the McKee that really is the one who's paying for the care of his mother in those ads. It's okay, Willa. That was my line. We need leaders that have rolled up their sleeves and worked in the community to provide care, improve access, and change people's lives for the better, and are not just worried about who's getting the credit in the local media. We need a governor that was not cast aside when the state needed responsive leaders at the start of the pandemic. We don't need Danny and his jammies on a Zoom call in his basement. We need a governor and a lieutenant governor that will provide home care workers with safe communities, to deliver health care services, and will stand up for all of our workers, all of the time, not just for some soundbite or a news story. We need a governor and a lieutenant governor that cares about people in the community over their cronies and their friends. We're here on the Pawtucket-Providence line. Imagine what could be done to transform access to home care and community-based support services in Pawtucket with $60 million, instead of it going to a soccer stadium for Dan to keep an allied mayor's political career from life support after one failed development project to the next. Instead of going toward a crumbling office building, imagine what $40 million would mean to Providence's underserved communities that Sabina has turned her back away from upon her elevation to Smith Hill. $100+ million gone from taxpayers' pockets, like another 38 Studios nightmare to come, or another road and bridge toll machination. Just imagine what an additional $100 million would do to solve our state issues if we can move on from the McKee-Matos era. The Rhode Island Partnership for Home Care PAC has been active in this and previous election cycles, supporting members of the General Assembly, both Democrats and Republicans, that advocate for home care and hospice. However, we have never endorsed candidates for governor or lieutenant governor until today. Ashley Kalus saved our state. Let me repeat that again. Ashley Kalus saved our state by having reliable COVID-19 testing and immunization sites. My organization knows this firsthand. Rhode Island became one of the more successful vaccination states because of her company and her employees. She made sure that vulnerable Rhode Islanders, including home care patients and clients, received the testing and vaccine that they needed. Aaron Guckian supported local community-based nonprofit organizations to continue serving disparate populations under all of the restrictions at that time. Through his leadership at the Rhode Island Foundation, he made sure that no one, absolutely no one, especially homebound Rhode Islanders, were left without the services that they needed to survive and the resources for their community agencies to remain in operation. Both candidates to lead Rhode Island has committed to expanding timely access to home care by reducing the long wait lists increasing funding for home care to maintain $20 and over for minimum wages for CNAs, nurse assistants, and competitive wages and benefits for skilled providers, including our nurses and therapists, enacting reforms to achieve rebalancing of long-term care financing toward home care and community-based supports, and inspiring the next generation to choose working in home care as a dignified and credible career pathway. Ashley Kalus and Aaron Guckian are the only choices for competent, compassionate, and clear leadership. This is why the Rhode Island Partnership for Home Care PAC emphatically and unanimously endorses Ashley Kalus for governor and Aaron Guckian for lieutenant governor. Congratulations, we wish you great luck.
Good morning, and thank you so much for that endorsement. I'm here today. My mother-in-law passed away from Alzheimer's, and she received all the care from the professionals behind me. In addition, my mother, who's here, is a respiratory therapist. I couldn't believe that the appointed lieutenant governor had only gone to one meeting since last November. It's shocking, it's appalling, and it's unconscionable. This is a crisis. It's a $1.2 million budget with 8 full-time employees. One meeting. I am so honored to be here with the employees in the back. I will advocate, I will be a problem solver, and I will offer solutions, and I will listen. No matter what, you got to get up and grind. You got to show up. And I'm going to show up for the professionals back here and for the people of Rhode Island. So with that, I'm so grateful and honored to be here. And I'm honored to introduce our next governor, Ashley Kalus.
Start my remarks in a second. Thank you so much for your support. Been with you in the last few years, and the comments about going through it together are really meaningful for me. So, thank you. Thank you to Nick and the entire association for having faith in my leadership and experience to deliver on behalf of your 20,000 plus members. Coming from the healthcare industry, I am uniquely qualified to understand the issues and help home care workers across Rhode Island. These heroes work tirelessly to provide care to seniors, veterans, the disabled community, and so many others, providing them with high-quality services in the comfort of their own homes. COVID brought forth even greater challenges in your field. While many were isolating in their homes, your workers were putting on PPE and delivering care to some of the most vulnerable populations during an unprecedented era. Society owes you a great deal of gratitude, and your government owes you a partnership that will help you address these structural challenges. You've had the back of hundreds of thousands of Rhode Islanders over the years, and know that I will always have your back as governor. Whether it is addressing reimbursement rates, travel costs, licensing, or workforce disruptions, with me, you have a governor who understands the problems and can identify areas where we can improve and deliver promised outcomes. Healthcare is a deeply personal matter and breeds an intimate relationship between the provider and the patient. We owe it to our residents to be as efficient, cooperative, and effective as possible to either help people recover from a medical episode or for others to allow them to live with dignity or age in place. I am humbled to receive your endorsement, and I truly look forward to working with you in the coming years. We have a lot of work to do, but with my ability to problem solve and the depth of knowledge your organization brings to the table, I have extreme confidence that we will be able to make impactful progress. Again, thank you. Thank you. Thank you.
we're going to take questions, obviously, if we can stay on topic. I know some people have questions about yesterday's 12 report. Kathy, we'll start with you, and you could just say who you'd like to direct your question
Actually,
to.
Nick, if you could help me understand some of the math of what you were explaining. What was the average hourly wage for a home care provider before the pandemic? You said there was some amount of extra money given to the industry. How much was given? And with that extra money, how much was added to the hourly wage of the home care workers, and when does it expire?
Sure. It's a lot of questions at once, Kathleen, but I've been to your press conferences before. So on average, pre-pandemic, average starting wage for a CNA, a licensed nurse assistant, was $13.50 to $15 an hour. With some workforce grant program, it's a temporary program funding, the administration, including his predecessor, mandated funds together to get starting wages up to $20 an hour.
And how much extra did they give the industry to get there?
It was just under $5 million through a workforce grant, this latest one, through the American Rescue Plan.
And it expires when?
March 31st, 2023. We've asked the administration several times for gap funding for the last quarter of the state's fiscal year, April 1st through June 30th, 2023. The problem is that there could be additional funds coming from CMS, the Federal Agency for Medicare and Medicaid Services. However, their approval process on average is 10.5 to 15 months. That would take us long after June 30, 2023. It would be too late. Once those monies expire, CNA wages would go back down to $15 or less. We have difficulty in the labor market, just like every other industry. But the difference is that when we don't have someone to provide care in a vulnerable elder or vulnerable homebound Rhode Islander's house, that means they're going back on the wait list and they're not receiving care. Their alternative, if family can't band-aid it together, that they end up in the hospital emergency rooms or they get warehoused in a nursing home.
How much, and just one last question, sorry Steve, just again another math question, just so I can understand what the core of this argument is. How much money does your industry get in this fiscal year? How much are you expecting? Or last year, either one?
From the state budget or overall?
Well, yes, from the state budget and the special grants that have come through workforce.
Sure. Average spending for home care, which is part of the home and community-based services budget, is about $80 million. And that is just to provide care to the Medicaid population. Not all of that money goes to home care providers. That goes to other home care related pet projects of this administration, like the personal care attendant program and the individual provider program, which is something that the Raimondo and McKee administration put together in order to support their ally at the State House, SEIU.
Is that a bad thing? When you say pet projects, it sounds like that there's a disparagement of that.
It is, because while we're supportive of providing voice and choice for homebound patients, we want to make sure that everyone receives high quality care. The home care agencies, like the ones I represent and the one in which we're in their office, are highly regulated by the Rhode Island Department of Health. These other pet projects do not have health department oversight. They have a third-party fiscal intermediary that's funded through the Executive Office of Health and Human Services. There is no nursing review of their cases. There's no nursing coordination with physicians' offices. And there is no other oversight to make sure that they're safe, that their plan of care is being met, and that they're receiving quality care. That is frightening. It is almost as frightening as April of 2020, when Governor Raimondo said, yeah, we have long wait lists and we haven't resolved them, but people should just go to care.com. That was insulting then. The SEIU IP program and the PCA program is also insulting. It's scary what happens to some of these folks.
Do either of you subscribe to Mr. Oliver's personalization remarks against the governor's mother and brother? I don't think I've heard you attack the governor's family.
what I will say is that healthcare workers and the healthcare system is in crisis. And it is a lack of leadership, a lack of competency that has gotten many in the industry in a place where we cannot continue this way. And so when we talk about short-term funding solutions, that was a gap because we have not addressed the structural issues in healthcare. That is what I will do as governor. I do not believe the governor has the ability to lead and to help us out of this crisis, and we deserve better.
Is that a no?
I mean, what in terms of the which part?
Mr.
Yeah, I mean-
Oliver's remarks attacking the governor's mother and brother.
I'm not going to go with that characterization, and I really want to focus on today the portion about how we're being supported and who we're being supported by. I am deeply grateful for the support of healthcare workers. The comments to me about my healthcare workers' contribution to helping during a crisis in Rhode Island were deeply touching to me. Really appreciated that. I'm so proud of the work that my workers did in a time, and you're all healthcare workers, in a time where we were in crisis. It was a lot for families. It was scary at times, and to just hear that acknowledgement is meaningful. I think you probably saw it. It was thank you. You don't hear that a lot, especially in the political season. So that is the part for me that meant the most. And I again want to thank my direct care workers that risked their lives, left their families, and did what they needed to do in order to help Rhode Island.
Mr. Guckian,
I'm gonna-
same for you.
What were you
Do you
going to say?
have?
Yeah, I'd like to clarify that first because I don't believe that I attacked the governor's mother at all in my comments. And I don't agree with your characterization of that in your question. What I did do in my remarks is differentiate the fact that the governor doesn't understand our issues because he has a mother that is taken care of through family money, through a successful business that his brother was able to maintain so the governor could enter into municipal and then state politics. That is not the average Rhode Islander. The average Rhode Islander, when they have their resources exhausted, they have to turn to the state system that they paid payroll taxes in for decades. So that wasn't an attack on his mother, but that was a characterization of the deep difference between what happens to everyday Rhode Islanders and those that are privileged, including decision makers that choose not to understand this issue because they won't face the same issue that most of those who they govern experience on a daily basis.
Seemed like personalizing this to an extent that we've not heard.
I would, in my position that I've been in for over a decade, representing workers that provide care for people throughout the continuum, the majority of whom are elderly, I would never attack an elder person, and I disagree strongly with your characterization, Steve. We've known each other for 25 years. You know better than that.
Aaron?
He clarified his position. Excuse me. I'm just here for, and thank you so much for the endorsement. He has his opinion. My position is simple. Sabina Matos is not going to meetings. She's the appointed lieutenant governor. At the very least, you go to meetings and you advocate for these people. People are dying. People aren't getting the care they need. And she's up there at the State House, and I don't know what she's doing. I'm here, I'm willing to work, and I'll have monthly meetings, at the very least, to help the people and to help the great citizens of Rhode Island. It's unconscionable.
And let me just follow and say, listen, that's a commentary on health inequity. And so there's a lot of talk about inequities and issues in healthcare about who accesses care and who doesn't. And so if you talk about it as a leader, you have an obligation to act. And the lack of action in a structural, sustainable way, it hurts everyone. And I think that is what the comment is about, is that there are haves and there are have-nots And if you profess to care about structural inequities in healthcare or access to healthcare, you have an obligation as a leader to do something. And not do something in a short way, but do the hard work of rebalancing, which is what we desperately need in this state.
What meetings are you talking, I'm sorry, I just need to clarify, Aaron. What meetings are you talking
Well,
about?
you can speak to it.
Well, it's your point, Aaron. You're saying she has not gone to meetings, she's sitting up at the State House.
Well,
what
yeah, if
specifically
you
are
see on my
talking about?
Twitter, in regards to all of the meetings, there's been 27 meetings that she was supposed to have. She's only attended
Of what?
13
Of what?
of the long-term health care, all under the purview of the Lieutenant Governor's office.
Okay.
For this particular organization, right, she's gone to one meeting
Since November.
since last November.
Since last November, there have been meetings, but she's only attended one meeting.
Yeah, or
of
there's
the
no
long-term
quorum,
care
or she
coordinating.
doesn't, yeah, or she doesn't show up. And Nick, I wasn't there because I'm running for this reason, and Nick can clarify exactly what's happened because I wasn't there. I'm running because of this ineptitude.
It's on his Twitter.
Yeah,
Thank you.
yeah, and they're the commissions that I had mentioned: the Small Business Advisory Council, the Emergency Management Coordinating Council, and the Long-Term Care Coordinating Council.
And she's been to none of them since last November.
Correct. No.
13 out of
she-
27.
Yes, yeah. Her record has been
It's
spotty.
all in the minutes of the Secretary of State. She has denied it. She's talked about that it's not true. I was the chairman of the Warwick Sewer Authority, a $300 million asset. I was there for almost 9 years. Every single meeting has to go through the Secretary of State and have to have the minutes. So all you have to do is do your due diligence. It's on my Twitter, respectfully. And once you see that, you'll...
It's on one tweet, or do you have like a series of tweets
Well,
where you
I'll
list every meeting?
I'll gladly get you that information.
If you could email me, I would appreciate it. I can make your point, but I'm not sure yet what it is. So, specific.
She's missing meetings. She doesn't have
Which
quorums.
Yeah.
She misses meetings. And for this particular group, she hasn't been to a meeting since last November.
And this group being Long-Term Care Coordinating Council.
Correct.
Is that the specific answer?
That's the specific answer.
Thank you,
Thank you
Aaron.
for the clarification.
Thank
And
you,
thank you
Aaron.
for all your hard work. I'm sure you have to show up a lot more than once in a calendar year.
Thank you.
Mr. Oliver, could you speak to the disparity between the levels of compensation that home health care workers get relative to the training, insurance, experience, licensing that they have to obtain in order to maintain these positions?
Sure. Actually, could I turn to one of my administrators to answer that question? It's a technical question.
Joint commission or
You
accreditation. I can do that. I'm sorry, I'm putting on a different hat if I start
I
doing
can.
that.
I just
Yeah.
don't want
Yeah.
to miss any points. Is that for an agency, they have to go through the Health Services Council of the Health Department in order to be able to be licensed. They have to determine that they will fulfill a gap of need of service in the community. They have to be licensed, bonded, nationally accredited. They have to pay for professional liability insurance, workers' compensation insurance, and everything else that an employer would in the state beyond just the requirements for a healthcare facility. Home care, unlike most states throughout the country, are licensed as facilities. Exception is we don't provide brick and mortar care. We provide care in people's homes, not in their offices. The individual professionals themselves, regardless of the setting of care in which they provide services, do have educational requirements, including paraprofessionals have education requirements, 130 hours of training for CNAs, just to be able to take a physical and then a written exam in order to be licensed and then have continuing education credits that they must submit for relicensure every year. Professionals have similar requirements under the Department of Health. Rhode Island requires home care agencies to use nurse assistants and go through the rigor of that license. Most states throughout the country use something called a home health aide. You don't have to look too far into Massachusetts to find agencies right at the border that have home health aides, which are trained and have a certification, but are not licensed by their state public health department. It makes it easier to enter into home care as a career.
And speaking of that, I just wanted to make one point. We tax PPP in this state, and I know that that's affected. And they can speak more to it and how much it's affected them. But we're one of the few states in the country. And by the way, it was stated we weren't going to tax PPP as a country. Now we're taxing it. They're paying the price, and the people right across the border are not.
Can I just clarify something you said, Nick, in answer to the question?
Yeah.
When I asked earlier about the average wages for the home health care workers, you cited the wage for CNAs. Now you're talking about home health aides. Are they the same?
Well, that's what the workforce that they use in other states. In Rhode Island, we are required to use licensed nurse assistants.
Well, then that's probably the answer I need,
Yeah.
which is what was the average pay before the additional money? What was the pay at the point you got the extra money through the coronavirus relief funds and workforce?
Yeah, that pay structure, that's the same. We are not allowed to use home health aides in Rhode Island.
So they're all CNAs,
They are all CNAs.
not nursing assistants. Nursing assistants and CNAs are the same. is what
Correct.
you're saying.
Correct.
Thank you
Correct.
for the clarification.
Number 86. Anything? All right.
Thank you.
Do you have a
Any
question or?
questions?
Other topics, if you can.
Yeah. Do you want to do it after?
Yeah.
Can I do it?
Okay.
All right.
Can I